Throughout this pandemic, we've told you numerous stories about how COVID-19 is impacting our lives and health.
For people living with dementia or Alzheimer's, there are now new questions we still don't know the answers to yet. And all new this morning, Brian Madrick talks with an expert on those diseases.
Over 500,000 Americans have died from COVID-19. Michelle DiMartino's parents are two of them.
They loved others more than themselves.
On February 25th, DiMartino talked about her parents with the University of Kansas Health System. She says her mom was relatively healthy. However, her dad had numerous health issues when he died. One was Alzheimer's.
He was actually very peaceful. When he went to hospice and he passed away on February 9th, my entire family was like, this is the most peaceful we've ever seen him.
Now DiMartino questions how COVID impacts the neurological disease.
I think there's not enough awareness out there for COVID patients who have Alzheimer's.
A global study plans to examine if there's a link between COVID-19, the brain, and people already living with Alzheimer's and dementia. The research was announced in the Journal of Alzheimer's Association. While researchers examine if there is a link, Dr. Jeffrey Burns with the University of Kansas Medical Center says what is known is that late stages of the disease could leave people vulnerable to dying from COVID.
People have trouble walking, they become bedbound in the late stages of disease. They have trouble, swallowing and eating. And so, yeah, there's some physical implications from Alzheimer's disease.
So this morning, Bryant joins us live from outside the University of Kansas Health System. Bryant, good morning. Did the doctor you speak with talk about any other issues that could be created or could come from COVID-19 with dementia and Alzheimer's patients?
Yes, good morning, Taylor. The doctor I spoke with told me there's at least two other connections between COVID and people living with dementia and Alzheimer's. The first is the fact that a lot of patients live in nursing homes, and we all know that nursing homes were hit hard during the pandemic with many people getting sick and many unfortunately dying. The other connection is the fact that during this pandemic, a lot of people could not visit nursing homes and facilities, and that created a situation of isolation. The doctor tells me that because of that, a lot of people who live with dementia and Alzheimer's were not able to get that mental stimulation that they need to stave off the disease. As a result, he says it only gets worse. Back to you.
All right, Brian Madrick reporting live for us this morning. Brian, thank you very much.